Goeienaand, good evening, fellow South Africans and citizens of the world. And in this time of crisis with this coronavirus spreading all over the place, what you need handling the situation are competent people. This is where South Africa is coming unstuck. The lockdown has already failed, clearly, and I've covered that in earlier videos today. It's going to serve no purpose at all, that lockdown. All it's going to do is kill the economy, or what's left of it, in South Africa. That's the only thing that it's going to do. And what about the public health system or the public hospitals? Well, what a complete and utter disgrace. Corruption was a major contributing factor to continued deterioration of the public healthcare system in 2019, according to the latest report from Corruption Watch. The non-profit said in a strongly worded report released on Tuesday, the state of the public healthcare system in 2019 continued to deteriorate, with services all but completely collapsing across many fronts and provinces. Corruption contributed in a major way in the form of irregular expenditure, financial misconduct, theft, illegal sharing of patient medical data to third parties, moonlighting, and nepotism, to name just some of the types of corruption brought to Corruption Watch's attention during the year. But of course there have been no arrests, have they? It's a gangster state. According to the 2019 report, titled "The Writing is on the Wall," nearly 700 reports of corruption were filed in the health sector between 2012 and 2019, with nearly 100 of these filed in 2019. The bulk of the reports were filed in Gauteng. Now, these are only cases that have actually been identified. There would be tens of thousands of cases of corruption going on in public hospitals and all levels of the public health system in South Africa. That's self-evident. The news comes amid a national lockdown in a bid to curb the outbreak of COVID-19 infections in South Africa, where there have been 1,380 confirmed cases. The majority of these, over 500, have been recorded in Gauteng. The report also comes as government works towards implementation of national health insurance, which aims to improve access to quality public health care. You can see this government's clueless. It's just absolutely clueless. The report notes a total of 673 reports of corruption in the health sector were filed in the last 7 years, with 92 in the last year. A total of 52% came from Gauteng, with the remainder coming from the other provinces combined. The next highest percentage of reports came from Mpumalanga at 11%. Most reports were regarding employment irregularities, 27%, followed by the abuse of power, 13%, and procurement irregularities, 11%. The organization warned of the potential dangers of corruption to patients in the public healthcare system. Tara Davis, in-house attorney at Corruption Watch, said, "Corruption in health procurement can lead to shortages in medical supplies, substandard equipment, inflated drug prices, and counterfeit medicines, all of which undermine health outcomes." The report notes South Africa is part of a 5-country study and advocacy campaign promoting open contracting in public health care procurement. The other 4 countries are Kenya, Uganda, Zambia, and Nepal. The project aims to ensure transparency and better use of limited public funds in healthcare. The report also argues spending on healthcare declined in real terms. According to the 2019 Budget Review Report, spending on health was set to grow annually by an average of 7% over the medium term, the report reads. But it adds, while on paper the health budget grew by 6.6%, in real terms a 6.6% increase represents a decline in health funding per person, once a standard inflation of 5.2% is factored in, as well as a growth of 1.6% growth in population. Corruption Watch said, "It is worth noting that medical inflation of the inflation rate for healthcare products and treatment is usually higher than that is the general rate of 5.2%. This year, Finance Minister Tito Mboweni announced that while the health budget would be getting 230 billion rand of the 1.95 trillion rand budget, there would be a 3.9 billion rand reduction on spending of the National Department of Health over a 3-year period. Funds for national health insurance would be protected, however," the minister said at the time. That's why the public health system in South Africa is in complete chaos. Great timing when the coronavirus is just about to decimate the country. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.